Welcome back, everyone. We're going to start our GU series by looking at the genitourinary anatomy and physiology. The GU system consists of the reproductive organs as well as the urinary system organs, and we'll start by first taking a look at the kidneys. The internal anatomy of the kidney is divided into three regions. You have the cortex, the medulla, and the renal pelvis. You can see on the larger image on the right-hand side of your screen here, the kidneys are connected via the circulatory system by the renal artery and renal vein, and then subsequently connected through the ureters to the urinary bladder, where urine is expelled from the body post-filtrate. The functional portion of the kidneys is the nephron. And within the nephron, and each kidney contains countless numbers of nephrons, there are veins and arteries that supply and remove blood flow. And then you have the filtering system. So as blood moves up the renal artery and through the arterial system within the kidney, it moves over to the glomerulus, which is where the filtering occurs. Filtered material is subsequently moved through the convoluted tubules, or those tan-colored tubules that you see, down through the loop of Henle, and then moved up into the collecting duct and moved out of the body, or into the bladder rather, as urine, while filtered blood is then moved through the venous return system back into central circulation. There are several points of interest in this area. The glomerulus is where the filtering occurs of the blood, and then looking at things like the distal and proximal convoluted tubules, as well as the loop of Henle, are important for advanced level providers, as depending on which diuretic you're giving will act in different areas of this process and help retain and or secrete additional amounts of fluid and electrolytes. Other organs of the GU system that are important to recognize are the male and female genitalia systems. The male genitalia system is made up of the sexual reproductive organs as well as the urethra, which connects the kidneys, the urinary bladder and the reproductive system for the expulsion of urine. It's important, there are a few structures here that we may encounter that we'll talk about in subsequent lectures. Areas like the penis, the glans penis, the scrotum, testes, and epididymis are all important to be able to recognize and understand normal physiology, as various pathophysiology states are common for us to counter in EMS. The female reproductive system, the external components are made up of the labia minora, the labia majora, the urethra, the vaginal orifice, the anus, and the perineum. The internal female reproductive organs consist primarily of the ovaries, the uterus, the cervix, and the vaginal opening. The ovaries are the primary internal female reproductive organ, and they lie on each side of the lower abdomen and produce ovum, or eggs. The fallopian tubes connect with each ovary via the uterus, and the uterus is a muscular organ where the fetus grows. The narrowest part of the uterus is the cervix, and the cervix opens to the vaginal canal. The vagina is the outermost cavity of the woman's reproductive system and forms the lower portion of the birth canal. You can see a front and side view of the uterus here as it's positioned within the female body. While it's often portrayed in a vertical upright manner, the uterus rests slightly anterior and superior within the vaginal canal and creates almost a hook shape, which is important when we talk about childbirth here shortly and how the childbirth process occurs and the articulation of the fetus coming down the birth canal. Other important things to note with the uterus and ovaries: the ovaries are not directly connected to the fallopian tubes. There are ciliated cells at the end of the fallopian tubes that will sweep the oocyte of the egg into the fallopian tubes, and this space that exists in between can lead to complications such as an outside of the birth canal fertilized egg, or an ectopic pregnancy that's occurring even outside of the fallopian tubes and in the abdominal cavity. Ovulation and menstruation begin with puberty. The onset of menstruation is called the menarche and occurs between the age of 11 and 16 years of age. The menarche, or the onset of menses or menstruation, can vary widely amongst populations, and it should be an important historical question that you assess with your patients, particularly if they're complaining about things like abdominal pain. Once menstruation begins, the female patient is capable of carrying a fertilized egg. And so there is a potential there for pregnancy-related complications in any patient that has begun menstruation and engaged in sexual activity. Women continue ovulation and menstruation until menopause, which typically occurs around age 50. Each ovary produces an ovum in alternating months, and this process is called ovulation. The process of fertilization begins in the vagina, where sperm is deposited from the male penis and passes through the cervix to the uterus and ends up in the fallopian tubes. The egg is fertilized within the fallopian tubes, and the fertilized egg continues traveling into the uterus, where it will eventually implant and attach itself to the uterine wall, where it will continue and grow. If fertilization does not occur within about 14 days of ovulation, then the lining of the uterus begins to separate and menstruation occurs for about a week. The process of ovulation and menstruation is controlled by female hormones. Most specifically, you have estrogen, luteinizing hormone, follicle stimulating hormone, and progesterone. And you can see on the chart on the right-hand side of your screen the phases of buildup of the uterine wall as timed with the phases of follicular development. So you have the menstruation phase where the uterine wall sloughs and reduces its thickness or preparation. At this point, you move into the next phase of the follicular phase would be ovulation. And then during ovulation, the egg is expelled from the ovary and is prepared for fertilization. And this is the luteal phase, where the uterine wall is beginning to build its depth in preparation for an implanted fetus. And if fertilization doesn't occur of the egg at that time, the cycle then starts back over. And this repeats about every 28 days or so.